Well, tonight we're hearing from doctors who say there's a new drug that shows remarkable success in lowering cholesterol when nothing else works. One Bay Area man swears by it.
You roll the dice and then say it's B. You have to come up with all these things with the letter B.
Scott Radabaugh is a single dad from Danville with an awfully big heart for Luke, Hannah, and Chloe.
I have 3 kids, ages 15, 11, and soon to be 9. Okay.
But unfortunately for Scott, there's a problem with his heart. He had no idea his life was even in danger until he had quadruple bypass surgery.
I was absolutely stunned. I couldn't believe it.
Scott was born with a genetic condition called familial hypercholesterolemia. The disorder floods his blood with dangerously high levels of LDL, or bad cholesterol. And that can lead to an early heart attack or stroke. For many, a low-fat diet, exercise, even statins won't do the trick.
Even on a vegan diet, taking maximum doses of statins, I can only get my LDL cholesterol into the low 100s.
Now a new high-tech wonder drug is on the horizon, and it's showing dramatic results in the hardest to treat patients.
We're seeing in most of the reported studies 50 to 60% lowering of LDL cholesterol, the bad cholesterol.
Stanford cardiologist Josh Knowles is Scott's doctor and an expert in the disease. He says this new class of drugs called a PCSK9 inhibitor is a game changer.
They're a triumph of the modern genetic revolution.
The drug was developed by studying the DNA of patients with the disease and pinpointing the problem. And while the treatment is expected to cost upwards of $12,000 a year, it may be worth it. The cost of a heart attack?
Just the immediate care is about $20,000 or $25,000. Lifetime care may be several $100,000.
Scott volunteered for a clinical trial. He's not sure if he got the real drug or a placebo, but the decision was a no-brainer for a father whose heart beats for more than just himself.
And I've got 3 little ones that I need to be around here for at least another 10 years until my youngest becomes an adult. So, and I have a goal of doing that.
The FDA advisory panel meets on June 9th and makes its recommendations from there. If the FDA then approves the drug, it could be available to Americans sometime this summer.